Hi there, John Farahmand here, the founder and CEO of Balanced Physical Therapy, with an important public service announcement. I don't think I've ever used PSA on one of these educational videos, but I want something to land, and I want it to land hard. The United States comprises less than 5% of the global population, but we consume 80% of the world's opiates. Let me say that one more time. The population of our country is less than 5% of the global population, yet we consume 80% of the world's opiates. They are overprescribed, they are overconsumed, they are over-depended upon, etc., etc., etc. And there's one question: why? Why? Well, I'm going to use the medical establishment because I'm a part of it. I'm a physical therapist, and I'm in outpatient orthopedic physical therapy and rehabilitation. We see patients all the time, and when we do their chart review at their evaluation, prior to bringing them back into clinic, we see that many of our patients have been prescribed opiates, okay, for pain. Lots of them for chronic conditions that they've had for many years. But why? If they haven't made a concerted effort to educate themselves, to strength train, to harden their minds, to harden their bodies, to create more mobility, to try more holistic means of getting out of the pain cycle through education, through exercise, etc., etc. Why are they consuming a drug that's not only going to have them addicted, but is likely going to reinforce their pain cycle if they're doing nothing else to break it? This is not a deep dive into opiates. This is not even a deep dive into physical therapy, but it's a message for everyone out there. If you're taking opiates now, if you've been prescribed opiates in the past, or God forbid, if you're addicted to opiates right now and you haven't tried an outpatient physical therapy practice who understands pain mechanics, who understands the underlying neurological mechanisms that mediate our pain and our perception of pain, if you haven't been taught about breathing techniques and about meditation and about different forms of exercise and movement that can actually dramatically impact your pain cycle, you're missing out on a tremendous opportunity. And that's my message. I am not advocating for my own practice right now, not at all. I'm advocating for you because I absolutely hate the fact that the US comprises less than 5% of the global population, yet we consume 80% of the world's opiates. It's just an absolute devastating fact. Don't take my word for it. You want to Google it? Google it. You want to chat GPT it? Go for it. It'll tell you the same thing. Okay? It's just a fact, and it's miserable. So, as a physical therapist, if you haven't got your move on, so to speak, and if you haven't recognized and realized that movement can be medicine when appropriately divvied out to you, when appropriately prescribed to you, when appropriately given to you in a manner that your body can tolerate and accept, you're missing out. You really are on one of the greatest, most powerful medicines that there is. Appropriately diagnosed movement dysfunction, pain mechanics, etc., and a way to short-circuit it with movement and exercise. So if you haven't, please seek it out. A personal trainer, great. Massage therapist, fantastic. Stretch lab, any manner of all of these different things that promote movement instead of pill popping. Please, outpatient physical therapy, my passion to help alleviate suffering in the world. Whatever you want to reach out for, please, if you haven't already, reach out for something other than an opiate. Please, I implore you. Thank you for listening. I appreciate your time.